So in this topic we will be discussing on neural disorders. As you can understand from the term itself, neural disorder or a neurological disorder is any condition that affects our nervous system or neurons. So some disease or disorder which is affecting our nervous system is known as a neural disorder. Our nervous system is mainly composed of brain, spinal cord and different types of nerves. So anything that is affecting the functioning of our brain or our spinal cord or the different type of nerves or network of nerves in our body can have an impact on your body, and that can be expressed as a nervous disorder or a neurological disorder or a neural disorder. So these disorders can disrupt or change the nervous functioning of the nervous system, and that will be causing different types of symptoms in our body depending on which part of the body. For example, if a leg is affected, a nerve passing to the leg is affected. Especially in old age people, there such kind of problems will be there, and this is known as peripheral nephropathy. So nerves may be slightly affected, there may not be much treatment and people will be having pain. So that kind of disorders are affecting the neurons, and that will be having different types of symptoms also. So here we will be focusing on mainly 4 types of disorder. One is dyslexia, another one is Parkinson disease, then Alzheimer's disease and epilepsy. And these are the 4 types of disease which is expected in your syllabus. We will have a brief idea on each one. So in the case of dyslexia, it is a learning disorder that primarily affects ability to read, write and spell. So some people may have difficulty. For example, they may have difficulty. This is D. So this is D, and I will show you some letters below, D and B. If you where is B? See, they may write B instead of D because the D and B look same. You understand that? This letter B is written like this and letter D is written like this. Here you will do. So they may confuse between D and D. Where they have to write B, they will write D. So that is a problem. So that kind of difficulty they will have, and that is usually known by the name dyslexia. And some people may not be able to pronounce certain word properly. Mostly it is in the written language this dyslexia is present. And because of this they have difficulty in reading the thing properly. For example, in the question paper, the question may be written directly, but they may be interpreting it in a different way because they think that it is D instead of B. So all these will be affecting their അഞ്ചന ഇട്ടുണ്ടായിരുന്നല്ലേ അനുഷ്ഠ ഓക്കെ ബാക്കി ആരുമില്ലല്ലോ. So all this will be affecting the interpretation of the question paper, and that will be leading to different type of educational problem. It's a very common problem actually, because a lot of people are affected by this dyslexia, and sometimes these children may not be able to get proper care also. Some parents may not be knowing the difficulties of these children. Some parents will be supporting them quite well, and anyway, generally what is happening in our society is that if anybody is having some kind of difficulty, most people will think them in a completely different way. They think that they are not intelligent, they are not good for anything, but actually these people are quite good, and they can do a lot of things which are not even possible for them. For example, many of the famous people like Elon Musk. You know Elon Musk, he's a very rich man. He is having a problem known as Asperger's disorder. This Einstein is having that problem. Isaac Newton had that problem. Charles Darwin had that problem. So most of the famous scientists are having this problem because they are thinking differently. Their brain is working different. That is why they become different. So in the case of dyslexia, recently I found that in the case of many people, if they are not guided properly, they may end up in some kind of criminal activity, because they are not given the proper opportunity for life. They have to do some kind of, because in the case of many criminals, this dyslexia is very common. Because if you take the in one study conducted in USA, in the jail, several people, a large portion of people who are in the jail are having this dyslexia. Because how they end up in the jail is that they are not getting the proper job, so they will take some, especially if they are coming from a poor family. If these people are not getting the proper type of job, they will finally end up in some kind of criminal activity. So it's a very important thing if for the social setup to work smoothly, this kind of situation has to be addressed properly. It is not generally related to general intelligence, but involves difficulty in recognizing and processing letter and words. So mainly different types of dyslexia is even very few people are even able to understand the difficulty. This condition results from difference in how brain process language. So that is the main problem, and there may not be any complete cure because it's the way their brain is actually wired. Now, what are the causes of dyslexia is often hereditary. In some families, if there are any dyslexia among in first generation or second generation or among cousins, there is a possibility that dyslexia can happen in their children also. And mainly it is due to the difference in the brain structure, particularly in the left hemisphere of the brain, where the processing of language is mainly done. Now, what are the symptoms of dyslexia? Individuals may struggle with the phonological process. They may find it difficult to pronounce certain words. That is the phonological processing. They cannot read very fast, reading fluency, and they may not understand, cannot decode. Especially many letters like D, B, etc. D and B is very complicating. Similarly, L and I. See, L and I are very similar. One is short, other is taller. The only difference is that for them it will be a big problem. Similarly, there are a lot of other words which are very similar to each other, and for them, distinguish between these words are very difficult. So that is our main problem. There are no cure for dyslexia, but specialized educational program and speech therapy can help improve the language skill. That is also a complicated area. Right now what our government is doing is that government is not actually caring these children properly. I felt it many times. If any children is having some kind of difficulty, they may the university or school will ask them to bring a certificate. If they bring a certificate, they will give 25% extra. So if with the 25% extra, if they write something, they will pass. So this is normally what is happening in our system. That is not the right way, and there are no proper care also in the school system. Sometimes 1 or 2 teachers may be appointed, and this one teacher will be caring students from standard 1 to standard 12. How can that be possible? How can a single teacher handle so many subjects from standard 1 to? So this is the policy our government is doing. The government is doing something just to convince people that we are doing. This is how this is the type of approach. Maybe in school you might have heard about IED. There is a category of students, and what they get 25% mark extra. So by simply giving them 25 mark extra, they will pass, but they may not be having the right training, and the teachers who are coming for helping them are not even properly trained. I have found them, they may be normal teachers who have given 1 year, 1 month or 2 month training. But in the use of, if you go to foreign countries, these kind of teachers need minimum 2 years of training. There is a type of BA known as special education. So actually in our state, children, these kind of children are poorly attended, and that is why many, if they come from a poor family, they finally become criminals. So this is it's an important, in USA such studies are there. Now another type of disorder is the Parkinson disease. Parkinson disease is a progressive neurodegenerative disorder that will be affecting the movement. It results from loss of dopamine producing neurons in a specific part of brain called substantia nigra, leading to abnormal brain activity. So normally what is happening is that dopamine is an important chemical. This chemical is very important for our maintaining our happiness, our pleasure. If there is a decrease in dopamine, it's a neurotransmitter actually, that will be affecting the mood of the person, happiness of the person, the feeling of pleasure, all these will be, the people will be very depressed. So exact causes of this Parkinson disorder nobody knows, but both genetic and environmental factors may have a role, because in families with one father or grandfather is having this problem, there is a higher chance that children can also develop a similar kind of problem. And similarly, exposure to certain type of toxin or certain genetic mutation like LRRK2, PARK7, these are some kind of genetic mutation. They are also increasing the risk of Parkinson disorder. So this is another case of. Then what are the symptoms of Parkinson disease? Mainly that will be tremor. I will show you a picture of Parkinson patient, so that you will be, they will be having a shaky hand most of the time. See, these are their hands. See, this is how the Parkinson. See, this is one good picture that can. See, here you can see that. See, their hands may be shivering. That is the main, and they have a stooped appearance. The body may be slightly tilted in the forward direction. The legs will be shivering, arms will be shivering, face will be shivering. So it's mainly a shivering. So it is by looking at this shivering that we will be able to understand that person is having this problem. So it is not that shivering is not a tremor. Then rigidity of the muscle, that is another problem. Bradykinesia, slow. Then see, you can see that they can move very, very slowly. That is another problem of this Parkinson disorder. Then postural instability. See how this person is standing not properly in the erect vertical pose. He may be tilting slightly to the forward. So that is also another problem, that is known as postural instability. Then as the disease is progressing, that will be affecting other areas of the brain, and dementia. Dementia means loss of memory. That will be also coming, and actually it is slowly the person may get may be going to death. That is the problem of the Parkinson disorder. So first there will be memory loss, then other parts of the body can also be affected. There is no cure for Parkinson disease, but treatments aim to manage the symptom, and this include medication like levodopa that can increase because right now we have some knowledge that dopamine level is decreasing. So we are giving drugs that are increasing dopamine, that is known as a levodopa. And deep brain stimulation, DBS. If you go to Aster and other big hospitals, they have certain centers for deep brain stimulation, which involves surgically implanting electrodes in the brain to reduce motor symptoms. So these are some techniques that are still trying, but still there is no proper cure, because we don't know exactly why this is happening. And what we have observed is that certain regions, especially the substantia nigra of the brain, and there will be a certain increased level of increased amount of dead cells in those regions, and that may be the reason for the Parkinson disease also. So this is regarding the next disease. Then we have another type of disease known as Alzheimer's disease. Alzheimer's is also similar to Parkinson. It's a most common form of dementia. Dementia means loss of memory and characterized by progressive loss of cognitive function. Cognitive means the functioning, our intelligence, brain, etc. And that will be including loss of memory, ability for reasoning, and all these will be slowly destroyed in this person. That is what is happening. And disease is marked by accumulation of amyloid plaques and tau tangles in the brain. I will show you this because in the case of Alzheimer's disorder, their brain, if you take the brain of these people, see, if you because in their brain there are certain type of, see, this is what is exactly happening in these people. Their brain will be gradually gradual destruction of their brain will be happening, and certain type of plaques, and these are actually protein bodies, they will be increasing gradually in the brain, and that will be leading to destruction or deterioration of the brain. And see, you can see that every part of the brain is slowly shrinking. So this is the left side is a normal brain, other side is a, so what happens is that their ability for thinking, remembering, planning, all will be gradually affected. So this is what is happening in the case of Alzheimer's disorder. So here you can see that it's a complex condition with the content, because genetics are playing an important role, lifestyle of the person, environmental factors are there, mutation in certain genes. So all these are increasing the chance of Alzheimer's, but still nobody knows why some people are having Alzheimer's. So there is no, we have not understood the real reason for Alzheimer's disease. These are some of the reasons we believe to be associated with Alzheimer's disease. Then what are the symptoms of Alzheimer's disease? One is clearly the loss of memory. Then confusion, difficulty, problem solving, disorientation. For example, one of my neighbor had this problem. Their children will be always locking the gate. What happens is that if the father is going out and going for a walk, he may not know how to come back to the house again. So that is known as a disorientation. We are, for example, I am walking to Guravalangad town. I don't know how to come back to the college. If I forget that direction, that route, that is a situation known as disorientation. So this is an important problem of Alzheimer's disorder. Then another thing is that there is a progressive withdrawal. First they will be withdrawing from society. Then in the second stage they will also withdraw from the family, and they will be mostly confined to their rooms. So first social withdrawal, then family withdrawal, then slowly over a period of 5 to 10 years they will die. So it's a gradual type of gradual death. As the disease is progressing, patient loses ability to perform daily tasks. For example, brushing the teeth or eating food. For everything they need support. So no one requires full-time care. So this is the problem of Alzheimer's. Those who have attended people with Alzheimer's disease, they know what are the difficulties of handling people with this kind of problem. So currently the current treatment focus on slowing the progression. We cannot completely control Alzheimer's disease. We can only progress them, and also managing the symptom. medication like acetylcholinesterase inhibitor, that is one type of disease. Then NMDA receptor antagonistic, this is another drug. These are the drugs which are commonly used. Then research is ongoing into targeted therapies and such as monoclonal antibodies, because the presence of amyloid plaques, as you can see that presence of this kind of plaques or protein bodies in the here you can see that this is another picture. So presence of this kind of amyloid plaques are responsible for Alzheimer's disorder. So if we can develop certain antibodies, and these antibodies can specifically destroy these amyloid plaques, then we will be able to treat Alzheimer's disorder. Right now, one of the important areas of Elon Musk is Neuralink. You might have heard about Elon Musk. He has so many areas of business. Neuralink, see, neurotechnological company. Now, what this company is doing is that they want to connect our brain with a computer, and that company is known as the Neuralink. So Neuralink is a company specialized in brain computer interface. So Elon Musk is one of the important area of Elon Musk is this Neuralink. So there are such kind of technologies are going on. So after a period of slowly all this technology will become big, because the computer will be able to interpret what we are thinking. What is the So that is the level of technology, and with the AI all this will be possible. So this is they will be implanting certain devices on our brain, and that will be giving a real-time feedback of how our brain is working. So that is the purpose of, so it's a new technology, but limited, see different type of devices are there, surgical robots, see, so you can, so these are new areas in, after some time even our mobile will be coming with this neural technology. So neural technology is going to be a reality in near future. So that is why these billionaires are spending a lot of money on research on these neural devices. So you can study about that if you want, if you are interested. So this is the third disease known as Alzheimer's disease. Now we have one more disease, that is epilepsy. So in this epilepsy, it is also a neurological disorder characterized by recurrent seizure. Seizure, you know this about epilepsy in Malayalam called chudali or abasmaram. This is what is happening. So epilepsy, I will show you some pictures of epilepsy. See, this is what is happening in the epilepsy. People with epilepsy will be having different types of problem. Especially they will be having, see this is what is happening normally. See, they may fell down, see, and they will be showing this kind of shivering symptoms. Right, these days it is very rare, but in when I was a student, this type of problems are very common among students. But now with the proper medication, this kind of seizures or epilepsy can be controlled to fixed. So this is known as epilepsy. What is happening in this epilepsy is that abnormal electrical activity will be there. Our brain is actually controlled by very fine electric current. But when there is a difference in that electric, that is why when we touch an electrical wire, we feel some kind of shock. That shock is actually, it is suddenly changing the electrical voltage of our body. That is why we feel shock. So seizures can vary widely from brief lapses in attention to loss of consciousness. So what are the causes of epilepsy? Genetics is playing an important role. Injury of some brain tissue can be a reason. Infection, bacterial or viral infection of the brain cells, then stroke, or presence of tumor. So all these are reasons for epilepsy, but in some cases we do not know why it is happening also. Now coming to the symptoms of epilepsy, primary symptom is a seizure, this kind of vibration, this kind of shivering is what is happening in the case of epilepsy. Then which can be focal, affecting one part of the brain or generalized involving the whole brain. Other symptoms may include temporary confusion, staring spell, uncontrolled jerking. See, this is what is happening in this picture, uncontrolled jerking. Hands and legs may be moving very violently. So that is then loss of consciousness. So all these will be are some of the important problems associated with epilepsy. Now about the treatment, right now we have anti-epileptic drugs, and these are primarily for controlling the seizure. That is why nowadays it is very rare. Most of the people will be having these AED drugs, anti-epileptic drugs, and in some cases surgery or vagus nerve stimulation can be done. And because there in some patients they may not be responding to the medication properly, for them surgery may be needed. Then lifestyle changes and avoiding triggers such as lack of sleep or stress can also help to manage epilepsy. So if people with epilepsy can have an increased problem when they are having stress in their life. So these are some of the diseases associated with neurological disorder. Then usually we are checking this patient by MRI scan, CT scan or EEG. Also we will be also using genes testing for diagnosis of these brain disorders. Then coming to the treatment part, mainly we will be giving then anticonvulsant for epilepsy, dopamine enhancer for Parkinson disorder, because Parkinson disorder is mainly because of low dopamine, levodopa, this is one drug. Then surgery like deep brain stimulation is one effect. Then physical or occupational therapy, when we went to this Kusumagiri Mental Hospital, there you can see that these people will be needing OT, occupational therapy, every time, because what that person told is that they are taking a lot of drugs for their especially psychiatric drugs. Most of the psychiatrics have too much severe side effect, so that they have to keep engaged in some activity every time. That is why they are playing caroms or other types of games, because their body has to be active. If they are not active, they cannot get sleep at night, and lack of sleep can increase their symptoms also. Then psychotherapy to address emotional as well as cognitive problems of this patient. So this is the approach to that. These are the things that you can do for treating neural disorder. So this is an idea regarding different types of neural disorder. Mainly 4 types are the dyslexia, Parkinson disease, Alzheimer's and epilepsy.